Hi, I am Dr. Saqib Mansoor, and today I will discuss with you the blood supply of brain. So first of all, you see here is the blood supply of the cerebral hemispheres, and then I will discuss with you the blood supply of the rest of the brain. So three cerebral arteries: anterior, middle, and posterior. Anterior and middle cerebral arteries are branches of the internal carotid artery, and the posterior cerebral artery is a branch of the basilar artery. You could see first of all the anterior cerebral artery, this color, this and this. It supplies the anteromedial surface. This is the medial part of the cerebral hemisphere. This is the anterior, and this strip on the upper strip on the lateral surface, right? And then the middle cerebral artery supplies the lateral surface. This is the lateral aspect, and this strip, this color supplies this the your lateral surface of the cerebral hemisphere. In the last posterior cerebral artery, it supplies posterior and inferior surfaces. This is the posterior aspect here, this is the posterior aspect, and this is a lot of area on the inferior surface. And now I will discuss the other areas blood supply. So brain is supplied by two internal carotid, two vertebral arteries. Two vertebral arteries make and unite to form a basilar artery. These four arteries are lying within subarachnoid space, and branches of these arteries anastomose on inferior surface of the brain to constitute a circle of Willis, whose detailed formation and diagram will be discussed with a visual mnemonic. It's very unique to my lecture. So internal carotid artery starts at the point where common carotid artery bifurcates, where it commonly has a localized dilatation termed the carotid sinus. It travels up the neck, perforating the base of the skull as it passes through the carotid canal in the temporal bone. And here you can see this is the internal carotid artery. This is the common carotid artery. Here it bifurcates, and this is the branch, one terminal branch as the continues as the internal carotid artery, and which goes up, and here it lies in the this cavernous sinus, which in the center it is present with the abducens nerve. Here it is horizontal. Then the artery travels horizontally, right? It comes out at the medial side of the anterior clinoid process as it perforates the dura mater. It then makes an entry in the subarachnoid space as it pierces the arachnoid matter and runs posteriorly to the area of the medial end of the lateral cerebral sulcus. At this point, it gets divided into anterior cerebral and the middle cerebral arteries. I told you these are branches of the internal carotid. From here, you can see this is the branch of the internal carotid artery. Here it is the internal carotid artery, and this one branch is the anterior cerebral artery, and this is the middle cerebral artery. So these two branches are of the internal carotid artery. And the branches of the cerebral portion of the internal carotid artery. Number one is ophthalmic artery, takes origin when the internal carotid artery exits the cavernous sinus. Here you could see this is the ophthalmic artery label, and this is the ophthalmic artery, right? It makes an entry into the orbit via optic canal, below and lateral to the optic nerve. It is source of blood supply to the eye and other orbital structures. Its terminal branches provide blood supply to the frontal area of the scalp, the frontal and the ethmoidal sinuses, and there are some of the nerves. Branches of the cerebral portion, the second one is the posterior communicating artery, is a tiny vessel that arises from the internal carotid artery in proximity to its terminal bifurcation. The posterior communicating artery travels posteriorly above the oculomotor nerve and joins posterior cerebral artery, thus constituting part of the circle of Willis. We'll discuss all these arteries forming the circle of Willis, 6 of them, with the diagram. Here you could see the posterior communicating artery. Here this is the labeling, and this is the posterior communicating artery, right? Coming from this internal carotid artery. And the third branch of the cerebral portion is choroidal artery. It's a tiny branch also rising from the internal carotid artery in proximity to its terminal bifurcation. The choroidal artery travels posteriorly near to the optic tract, makes entry into the inferior horn of lateral ventricle, and it ends in choroid plexus. It gives origin to the many tiny branches to the surrounding structures that include the lateral geniculate body, the crus cerebri, internal capsule, and the optic tract. Number 4 is the anterior cerebral artery, right? The smaller terminal branch of the internal carotid artery travels forwards and medially while it is superior to the optic nerve and makes entry into the longitudinal fissure of the cerebrum, right? So longitudinal fissure. Here you could see this is the anterior cerebral artery, right? This is the, coming from this internal carotid artery. This is the anterior cerebral artery. Then there it joins the anterior cerebral artery of the opposite side by the anterior communicating artery. You could see it's very important. This is anterior cerebral artery of one side. This is anterior cerebral artery of the other side. And this is joined by the anterior communicating artery. This is the anterior part of the formation of the circle of Willis here. This is the circle of Willis. It then curves backwards over corpus callosum and in the end anastomosis with posterior cerebral artery. Right here, this is the posterior cerebral artery, and here it is anastomosis with that. The cortical branches provide blood supply to whole of the medial surface of the cerebral cortex as far posteriorly as the parieto-occipital sulcus, right? So let's see the picture, the cortical branches. Here you could see the cortical branches of the anterior cerebral arteries. Here you could see this. This is the anterior cerebral artery. Here, this area, this whole area, and this area, right? So you see, focus at this area, this strip upper. Besides the strip of the cortex about 1 inch wide of the adjacent lateral surface, the anterior cerebral artery thus is the source of supply to the leg area of the precentral gyrus. A bunch of central branches pierces anterior perforated substance and assistance supplying part of the lentiform and the caudate nuclei and also the internal capsule. So the cortical branches of the anterior cerebral artery branches to the parietal lobe are the superior internal parietal and the inferior internal parietal, and branches the frontal lobe. You can see from the picture. Let me show you. See this, these are the cortical branches of the anterior cerebral artery on the medial surface of the hemisphere. These are the parietal branches, superior internal parietal, the precuneal artery, and the inferior internal parietal artery. Yeah, this is the, you could see the two branches, right? These are the cortical branches, the anterior cerebral artery to the parietal lobe, right? And you could see this, the temporal pole is supplied by the middle cerebral occipital lobe by the posterior cerebral arteries, right? Branches of the cerebral portions of the anterior cerebral artery. The middle cerebral artery is the largest branch of the internal carotid, runs laterally in the lateral cerebral sulcus. So important, this is a lateral cerebral sulcus. It runs there. Cortical branches provide blood supply to the whole lateral surface of the cerebral hemisphere, except the narrow strip supplied the anterior cerebral artery, the infralateral surface of the cerebral hemisphere, and the occipital pole, which are supplied by posterior cerebral artery. This artery runs all the motor area except the leg area. Central branches make entry into the anterior perforated substance and provide blood supply to the caudate and the lentiform nucleus and the internal capsule. Let's make use of the pictures, right? So we're talking about the middle cerebral artery. Here is the origin of the middle cerebral artery. And here you could see this. These are the cortical branches of the middle cerebral artery. This you can see are the Rolandic artery is labeled here, and the pre-Rolandic artery. These are the cortical branches of the middle cerebral artery. And this is the left middle cerebral artery. This is the right middle cerebral artery, and supplying the lentiform nucleus and the caudate nucleus, right? It supplies the tube. Now talking about the vertebral artery. Vertebral artery is a branch of the first part of the subclavian artery. It descends the neck by traveling through the foramina in transverse processes of upper six, C1 to C6 cervical vertebrae. It makes its entry into the skull through foramen magnum and enters the subarachnoid space by piercing dura mater and the arachnoid. You can see this is the foramen magnum through which enters the skull. Then the artery travels upwards, medially and forward on the medulla oblongata. You could see from the picture. This is the, right? This is the vertebral artery, right? And here it is going through that. This is the medulla oblongata. It's traveling in over there. At lower border of pons, it joins the artery of the opposite side to constitutes the basilar artery. You could say this is the formation of the basilar artery from the two vertebral arteries. One this side and the second other side. Two vertebral arteries form the basilar artery. And this gives very important branches in the formation of the circle of Willis. And branches the cranial portion of the vertebral artery. The meningeal branches are tiny and supply blood to the bone and the dura in the posterior cranial fossa. And the posterior spinal artery can take origin from the vertebral artery or from the posterior inferior cerebellar artery. It runs down on the posterior aspect of the spinal cord, lying close to the posterior roots of the spinal nerves. The branches get reinforced by the radicular arteries that get entered into the vertebral canal through intervertebral foramina. The anterior spinal artery, very important source to the anterior two-thirds of the spinal cord, is constituted from a contributed branch from each of the vertebral artery near it. And the single artery runs, you notice anterior spinal artery is single and the posterior spinal arteries are two. It runs down on the anterior aspect of the medulla oblongata and spinal cord, and it is enveloped by the pia mater along anterior median fissure. The artery gets reinforced by the radicular arteries that make entry into the vertebral. I told you already. So you could see this. This is the anterior spinal artery. Branches of the cranial portion are the posterior inferior cerebellar artery. Is the largest branch of the vertebral artery. It travels on an irregular course between medulla oblongata and the cerebellum. And here you could see this is the posterior inferior cerebellar artery. It's coming from here, there from the vertebral artery, posterior inferior cerebellar artery. It supplies blood to the inferior surface of the vermis, the undersurface of the cerebellar hemispheres, and the central nuclei of the cerebellum. It also supplies blood to the medulla oblongata and the choroid plexus of the fourth ventricle. The medullary arteries are very tiny branches that get distributed to medulla oblongata. So very important, the basilar artery. The basilar artery is constituted by the union of the two vertebral arteries, told you already, yes, and in the basilar groove, a basilar groove on anterior surface of the pons. It divides into two posterior cerebral arteries at the upper border of the pons. So two posterior cerebral arteries. Here you could see this is the formation of the basilar artery, right? The two vertebral arteries, one here coming, other from the here's other side, not visible, and they unite here, right? And on the basilar groove of the pons, and this is the basilar artery. Here you could see as well, this is the basilar artery formed by the union of the two vertebral arteries, one from this side, one from this side. This is the large basilar artery. It's branches of the basilar artery. The pontine arteries are various tiny vessels that get entered into the substance of pons. The labyrinthine artery is a narrow, long artery that accompanies cranial nerve 7th and 8th in the internally caustic meatus and supplies blood to the internal ear. It frequently takes origin as a branch of the anterior inferior cerebellar artery. These are the pontine arteries. You could see this. This is the basilar artery, and these are the pontine arteries, and these are the labyrinthine arteries. Then the anterior inferior cerebellar artery travels posteriorly and laterally and as a source of supply to the inferior and interior parts of the cerebellum. A few branches travel to the pons and upper part of the medulla oblongata. The superior cerebellar artery takes origin close to the end of the basilar artery. It takes a curve around the cerebral peduncle and provides blood supply to the superior surface of the cerebellum. Besides, it supplies to the pons, the superior medullary velum, and pineal gland. You see all these again. This is the superior cerebellar artery, right? Branch of the basilar artery. This is the pontine artery. Show you already. Anterior inferior cerebellar artery. I showed you already this labyrinthine artery. So another branch is the posterior cerebral artery, very important. And cerebral artery posterior takes a curve backwards and laterally around the midbrain and gets joined by the posterior communicating branch of the internal carotid artery, right? So this is the posterior cerebral artery, and here it gets joined by the posterior communicating artery. Here you could see this constituting the posterior part of the circle of Willis. Cortical branches of the posterior cerebral artery supply blood to the infralateral and the medial surfaces of the temporal lobe and the lateral and the medial surfaces of the occipital lobe. So the posterior cerebral artery supply blood to the visual cortex. Anterior and posterior temporal artery, medial and lateral occipital arteries, parieto-occipital artery, and the calcaneal artery are the branches. You could see the cortical branches of the posterior cerebral artery seen from inferior and medial surfaces. Splenium of the corpus callosum is supplied by the callosal branch of the posterior cerebral artery. Here you could see this all branches. This is the, you can see this is the anterior temporal artery. This is the first you see posterior cerebral artery, and this is the anterior temporal. This is the posterior temporal, and this is the calcarine artery. This is the parieto-occipital sulcus, and this is the parieto-occipital artery. These are the cortical branches of the posterior cerebral artery. So central branches of the posterior cerebral artery feeds brain substance and supply blood to the parts of the thalamus and lentiform nucleus as well as midbrain, the pineal, and the medial geniculate bodies. It gives rise to the medial and lateral posterior choroidal arteries, which supply blood to the pineal body, the dorsal thalamus, and choroid plexus of the lateral and third ventricles. So very interesting and very, very important. The circle of Willis. The circle of Willis is situated in the interpeduncular fossa at the base of inferior surface of the brain. So location is interpeduncular fossa. The anterior part of the circle is situated in front of the optic gallery, while the posterior part is just below the mammillary bodies. It is constituted by anastomosis between the two vertebral arteries and two internal carotid arteries. So it's an anastomosis, two vertebral and two internal carotid arteries. Here you could see this already. This is the overall anastomosis, and we'll go according to a system and a scheme. This is classical anatomy. Circle of Willis, arteries contributing to the circle of Willis. These are the six. Number one, anterior communicating. Two is the interior cerebral, internal carotid, posterior communicating, posterior cerebral, and the basilar. And you identify from here. This is the circle of Willis. This is the classical picture. First of all, you see number one, anterior communicating present between two anterior cerebral arteries, so 1 and 2. And then number 3 is the internal carotid, one here, this is the other side. And number 4 is the posterior communicating. And number 5 is the posterior cerebral artery, right, branch of the basilar. And then number 6 is the basilar itself. So this is the formation of circle of Willis. And this is a visual mnemonic I made for you, this circle of Willis. You could see this looks like A. You see this? This is A, and interior cerebral artery, and here you could see this is the communicating bridge, right, which is the anterior communicating artery. So anterior communicating, anterior cerebral, and this is the internal carotid artery. This is the looking, eye, and eye. This is internal carotid artery, and this is an P formation word letter, and this is the posterior communicating artery, and this is the posterior cerebral artery. This is the P alphabet, and this is the B, the basilar artery. You can remember very well by this mnemonic. Circle of Willis allows blood to enter brain by either the vertebral arteries or internal carotid arteries and to get distributed to any portion of both cerebral hemispheres. Central and cortical branches take origin from the circle and supply blood to the brain tissue. Variation, the sizes of the arteries forming the circle are not uncommon. So this is the circle of Willis. You can see this. I shown you already formation in discuss in detail. So on the arteries specific brain areas, this is the last topic. And these are the internal capsule and the corpus striatum gets supplied largely by the lateral and medial striate central branches of the middle cerebral artery. I showed you already. Here you could see this is the left middle cerebral and this is the right middle cerebral. And you could see lentiform nucleus, internal capsule, the caudate nucleus. This is the corpus callosum. And the remainder of these structures get supplied by the central branches of the anterior cerebral artery. The thalamus is supplied largely by the branches of the basilar, posterior cerebral, and the posterior communicating arteries. And the midbrain supplied by the basilar, superior cerebellar, and the posterior cerebral arteries. The pons get supplied by the superior, anterior, and inferior cerebellar arteries and the basilar arteries. The medulla oblongata gets supplied by the basilar, vertebral, posterior, inferior cerebellar, anterior, and posterior spinal arteries. And the cerebellum gets supplied by the posterior, inferior cerebellar, anterior, inferior cerebellar, and superior cerebellar arteries. I thank you very much for listening to my lecture. And this is the picture in the last, very important. And this is the color-wise distribution of the schematic drawing of coronal section through cerebral hemispheres at the level of the internal capsule and thalamus. It shows main vascular territories. You can identify this color and you can learn and I just don't think it's any point left for me to discuss with you. You can see this picture afterwards and interpret on it on in view of my whole lecture previously. So thank you very much and stay tuned. Lectures coming regularly. I asked for subscriptions if you like. Thank you very much.